And Kat, I think we should all introduce ourselves, the Board of Health members tonight.
Okay.
And we are recording.
Okay. So let's just wait a minute and see if I assume Al is coming. I think he's just late. He didn't say he wasn't. And my goodness, he's certainly gotten enough homework from me in the past few days that he knows there's a meeting. My gosh.
Once we officially start the meeting, as I admit people, I'm not going to announce further.
Okay. Okay, then when people speak, we'll make sure they tell us who they are. And if there's anybody else, we'll try to catch them somehow.
And here's Al.
Oh, great. Okay, since we have everybody here, why don't we get started? We're live now. This is the Board of Health meeting for May 5th, and it is a virtual meeting that's being recorded for the convenience of those who can't be here or those who want to experience it again. Thank you to our guests for coming to speak with us or to listen to us. You are most welcome. I am Catherine Hilton. I am the clerk of the board.
Hi, I am Noreen Pease. I'm board chair.
I'm Arlene Reed, plain old member of the board.
We need a title for you, Arlene, in view of your special responsibilities.
No, you don't. But if you want to give me one, that's okay.
I'm working on making one up right now, Arlene.
Okay, that's good.
I'm Garrett Simonson, a member of the board.
You're muted, Al.
I'm Al Werner. I'm a board member as well.
So I wanted to do two tiny bits of business before we start. I put on the agenda we would start our discussion about the mosquito business at 7:05. The first thing I would like to do is I would like to have your approval for the minutes of the previous meeting that were distributed to you. Is everybody good with the minutes?
I have two proposed changes.
Okay, let's hear them.
So the third to the last paragraph, entities, is a typo.
Entity is a typo?
Yeah, entities is a typo.
Entities is a typo.
And
what should it be?
I think it's misspelled.
Oh, okay,
Yeah.
I'll fix that.
And the second to the last paragraph, instead of to a competent person, I would prefer to see to the appropriate person to respond.
Exactly.
Much better, much better. Okay.
Yeah, it makes it sound like our town clerk is not a competent person.
Actually, I meant me, our board clerk.
I said, oh.
Okay,
Oh,
okay, so maybe we'll make that
I
clear
see.
too.
Okay,
Clerk,
got it.
that the clerk is me. All right, I will.
Yes.
I will
Okay.
make those adjustments. And with those changes, is everybody satisfied?
Yes.
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 All right, thank you. Some news that we have is that we have received the first copy of a PFAS test. It's down Leverett Road, pretty far toward Leverett, and it is negative for PFAS 6.
Great. The water sample from my own home was just picked up today, so hopefully we'll have results to convey soon.
Mm-hmm. Sure.
I will say that the process was not easy. There was lots of, they have you view a video and follow some printed instructions for sample submission, and it does not conform with the sample kit that you're given, and the phone number that they give you to call to arrange for courier pickup didn't work, and there were all kinds of obstacles to get through.
Oh,
Saying. So I can put together some clarifying stuff if we want to, you know, in a next community message encouraging participation, if we want to include that. So
that might be a good idea. And also maybe we'll send that information to the UMass person, that Jody Cutler, who
yeah, it was a
you
challenge.
should have it. Yeah, yeah. It sounds like it was real sloppy. Okay, shall we go on to this mosquito spraying opt-out thing?
Kat, before we do that, may I
Yeah.
just state who I see now is with us tonight to make sure that we have everyone present for the record.
Okay.
I have Joan Hanson, Craig Martin, Mary David, Cliff Reed, Zipporah. I'm not sure who Zipporah is. I'm wondering if that person,
I know who Zipporah is.
you know who Zipporah is. Okay, great.
Where
Mary Jo Johnson,
top left, second middle. Oh, it says
Emily
Greg Corcoran.
Bernard, April Stein, and Miriam DeFont, and Silviva Lavana. Are
Excuse me,
there
that's-
others who are present?
I could,
Yes.
can we make a correction? That's Emily Bayard, not Bernard.
Okay, thank you.
If
Bayard,
we're looking at
is
the
that
same
correct?
screen.
Correct.
Yes,
Okay,
thank
thank
you.
you.
Thanks, Arlene. Okay. Thank you.
Okay.
Um,
I was going to ask everyone who's not speaking to mute themselves, because there's lots of noise. Thank you.
And then Noreen and Kat, on my end, so I'm acting as meeting host, and so I'm watching to let additional people in as they're requesting access to the meeting. And so for individuals who do wish to speak, there is at the bottom of the screen the raise hand function, and so that's how I'll look for individuals who wish to comment.
Okay, are we ready to roll? Because before we take public comment, I just want to make a few remarks about this. I really want to make it very clear that there is no plan to carpet bomb Massachusetts with insecticide. The law permits the Reclamation and Mosquito Control Board to spray in certain areas under certain circumstances. And those circumstances are basically when there's widespread mosquito-borne disease in an area, in a fairly large area, and it is found that local control measures are not working well. For this to happen, the Massachusetts Department of Public Health has to issue some kind of emergency certification. It's not a trivial matter. And I don't think it happens very often. We are about to come into what I believe is year 3 of a Tripoli outbreak, and they usually last 2 to 3 years. So once we get through this year, we should have a few years off from this, although the outbreaks are getting closer and closer in time. So right, we can't be too complacent. So that's kind of the background on this. I believe it was last year a new clause was added to this law that allowed municipalities to opt out, and in order to opt out, they have to the executive branch of the municipality, in our case the select board, is responsible for doing that. They have to consult with the Board of Health, and they have to submit a local mosquito control plan, which which we could do rather easily. That would not be a problem. So what we're going to do tonight is we're going to hear what people have to say, and brevity is most appreciated, I assure you. Then we are going to deliberate, and we are going to vote on what kind of recommendation to send on to the select board. The select board is meeting on Tuesday, the 11th, and this matter is on their agenda. We were a little bit blindsided by this because notification hasn't been really good. And so it's kind of a rush. So with that, I think we can go on to hearing your comments.
And so to the chair, I show that Azelle has her hand raised.
Yeah, thank you. Thank you. And thank you for being on the Board of Health. That means a lot to me. I live on 327 Wendell Road, and I have not only I'm a past beekeeper, a few years, I haven't been doing it recently. So I have a deep concern for pollinators. I work with Tom Sullivan at Nolambika Project on pollinator gardening and really how do we support pollinators. So that's one concern, is how these chemicals, there's a lot of unknowns about their impact, and there's a lot of knowns. And the other part is that when there are chemicals sprayed, I think there's this, at least my sense is that there are a lot of unnecessary critters that go down because of the chemical pesticides. And so that's concerning to me, of the insect life. And I was just talking to a friend earlier, why don't we make a lot of purple martin habitats and put them everywhere, and, feed purple martins eat mosquitoes very well as bats. And, so how can we kind of pay attention to that circle of life as opposed to trying to kill it? I understand that the encephalitis tripoli issue, and maybe if that's an issue, then we try something. But I can imagine a town-wide going around dealing with tires and water, and I don't know. I don't have the solution, but I hope that the answer from the Board of Health is going to be as natural as is at all possible. So, and I'm sure there are much more informed people here to speak about that. So thank you.
And Azelle, if you can click the raise hand button and remove it. So next to the chair, Miriam.
Hi, thank you. Well, I want to piggyback off of what Azelle's saying. I have a lot of concerns about blanket spraying. And I would like to see the town opt out of the spraying program. From the research I've done, the typical solution used by municipal governments involves spraying a synthetic petrochemical pesticide, particularly one that's used is Anvil 10+10, which is a pyrethroid. And it has been found to be a potential carcinogen for humans and to affect human immune systems as well as insect biodiversity. So I am concerned about, as well as using other kinds of chemicals like herbicides for control of invasives. I'm very concerned about using this as a mosquito control strategy. I hope we'll opt out.
To the chair, next is Mary Jo.
I wanted to thank you for inviting the public here. I think that's great that you did that. And I don't claim to be an expert, but I do know that the alternative plans tend to be about public education and prevention. So I don't really see a downside. I think an alternative plan would actually be better than a reactive, potentially poisonous spraying. So that's my thought.
To the chair, Emily is next.
Okay. For the sake of brevity, I'm going to read something that I wrote. My name's Emily Bayard, and I've lived on West Pelham Road for 27 years. I'm very concerned about the State Reclamation Mosquito Control Board and their proposed energy.
If you like, I can search the web for.
I must have said something because Siri is responding to me. After the state okay, I'm concerned about the proposed emergency spraying of insecticide. I personally know the harm that pesticides can cause. Several years before moving to Shutesbury, I was exposed to a pesticide that made me seriously ill for a full year. That pesticide has now had been in long-term use and had been deemed safe. However, 3 years after I was poisoned, it was suddenly pulled from stores and prohibited from residential use because it had harmed so many people. Since then, I have had significant long-term health issues from pesticide poisoning, including cancer. It has affected every area of my life and has impacted my family as well. I am limited as to where I can go and where I can work. My home is my safe space. If there is aerial spraying of pesticides, I will lose that refuge as well. I ask that the Board of Health recommend that the Select Board initiate, that the Board of Health recommend that the Select Board initiate the process of applying, is Siri again, of applying to opt out of this plan. Sorry about that.
I don't know if for the record, we have to document that Siri was at the meeting or not. But
Twice.
So Emily, if you can click the raise hand button, so that goes down. To the chair next is Craig.
Hi, Craig Martin, 17 Hidden Meadow Road. I certainly hope that we do not have to spray. I agree with all the previous commentators that this is a serious thing and should be taken very seriously. And there are lots of downsides in terms of bee populations and sensitive individuals, et cetera. I also agree with the previous speakers that we should take preemptive mitigation efforts early on before we have any problems at all, with the aim that if we do that, then we will never reach the level where we need to have spraying. But given that this disease is rare, I understand that should also be taken into account. But given that it has a fairly high fatality rate and that the impact is largest on individuals under the age of 15, I think we do have to be cautious and careful about the health impacts and even potential fatality impacts on citizens in Shutesbury. So I think it would be a mistake at this point to say we will not spray regardless of what happens. I think that to limit ourselves at this point is a mistake. If it turns out the outbreak is incredibly large and there's a substantial impact to human health, then we should not have this solution taken out of our option pool. Again, I think the option should only be used as a last resort, and it appears that is the policy. But I do not think that we should be taking this off the table at this point when we have no idea what the prevalence rate is. That's it.
Craig, if you can hit the raise hand button, please.
I can do that.
Thanks. To the chair next is Gail Huntress.
Hi, all. Thanks for making time for public comment here. And I just had a quick question to Craig's point, which I very much agree with. Does doing this mean that we can never spray, or does it just mean that the spraying option is in the hands of the Board of Health and the Select Board?
I can speak to that, Gail. For one thing, this is a 1 year exemption that we're asking for. It would have to be repeated any other year. For another thing, it only applies to spraying by the mosquito control board, the whatever's reclamation and mosquito control board, when they, if and when they spray large swaths of land. It would not mean that we could not spray on our own initiative in town. And my guess is if there is a horrible event and they want to spray and Shutesbury has opted out and we say, wait a minute, we think we should join, I don't think that would be a problem. But basically opting out allows us to take the matters into our own hands so that it's not imposed on us, even if for some reason we should choose to do spraying. And we would probably want to use something smaller and more targeted, maybe not the aerial spraying, but really focused and targeted ground spraying. So we're not taking any options off the table except to have the I can't remember the initials of that board overfly us with planes and insecticide.
Great, thank you, Catherine. That makes a lot of sense to me. I love the idea of local control, that we get to decide what gets put down in Shutesbury. And I did I like to look at data, at information. So I looked at some numbers and it looks like there's only been 110 total cases in humans since 1938. If you average that out, it's less than 2 cases a year. But even if you're very generous and say, okay, let's say that there's 10 cases a year, like there was 12 in 2019 and 5 in 2020. So say there's 10 cases a year, there's 6.8 million people in Massachusetts. So the risk to humans is 0.0000015%. So to lay something down to prevent something that is that low risk, knowing that the chemicals have these adverse effects to insects and pollinators and amphibians and animals and all of us, it makes absolutely no sense. Again, if there's an epidemic, this should be on the table, but only in the case of a huge outbreak. Look at the numbers when this decision is made. Otherwise, it should not be an option, in my opinion. That's all.
Okay, thank you, Gail. So to the chair, I don't know if we want to take new comments. So I'm going to take new comments first. So Zipporah, please.
Yes, hi, thank you for this opportunity to have public comments. I'm going to just abbreviate and agree with everyone else who has expressed their concerns for amphibians, aquatic life, pollinators, and just point out a couple other things about these chemicals. Studies are mixed on the effectiveness of spraying. There were cases where they had virtually no effect on the mosquito population after aerial spraying. There's chemicals in the pesticides, that the forever chemicals that can very quickly enter wells and groundwater, and being in a watershed here that is providing water for a lot of people, including Boston, it seems like a bad idea to have spraying here. When I was on the ADA committee, we did a survey of town residents to see who had what kind of disabilities, and there was a number of chemically sensitive people, which Emily had described her chemical sensitivity. I'm also chemically sensitive. There was over a dozen chemically sensitive people disabled with this in Shutesbury. And this would be really, really scary and traumatic for them to even know that this was a possibility. Children are also very susceptible to pesticides, much more so than adults. And
there's also areas, for instance, in Florida, there's areas where there is regular mosquito spraying that just have eradicated a wide range of other wildlife. My dad, who lived in Florida and in an area like that, hadn't seen a single butterfly in 15 years. And that's just really not a good thing for the whole world and the ecosystem and biodiversity. And just one last thing I want to mention is that mosquitoes, besides breeding in little areas around our yards that collect water, unpaved roads where there's been a vehicle driven on muddy conditions leaves a puddle that forms and breeds mosquitoes under the right conditions. So there's a lot of areas in town that are not people's backyards that are breeding mosquitoes because there's just puddles there. And, you know, in our natural environment, we would have water flowing. There wouldn't be puddles like that. So that's just something else to keep in mind. So thank you very much.
So we've had at least one new guest join since public comment on mosquito aerial spraying. So for that individual, if you do wish to comment on this matter, if you'll just hit the raise hand button. And so Noreen, to you, there is one additional person who has already commented but has raised their hand again. Do we wish to continue?
Let
Pleasure.
me ask the rest of the board if we wish to continue. I think at the beginning we had asked that we try and limit the amount of commentary. We do have a long agenda tonight. However, we want to make sure everyone gets to say everything that is important to them. So let me ask other members of the board how they're feeling.
Garrett, is this the last person who wishes to speak? Is there anybody else waiting in line?
It's the last raised hand at this point.
It would be okay with me if that person wants to add something.
And with me.
I agree.
Agreed. So to the chair, Craig Martin.
I just had a follow-up question. So if we don't opt out of this, does this mean that the state can come and spray us without contacting the Board of Health or the Select Board?
I don't think that it happens that way, Craig, but I'm not positive. I think that there is.
If that's the case, then I'm in favor of opting out. But if they would contact us before spraying, then again, I don't think it makes sense to put an extra barrier in place. But I just wanted a clarification. That's all.
I'm pretty sure that there is notification, but I couldn't swear to it.
So we do have a repeat request for comment.
Yeah, hi, this is Zipporah. Just in response to what Craig said and asked, a notification implies that we'd get a warning that they were going to spray, not that we'd have a chance to say, no, we don't want you to at that point.
Right, I believe you're right about that, Zipporah.
Okay, Zipporah, if you could click the raise hand button, please. And there has been an additional guest who's arrived to the meeting. So if that individual is interested in commenting on the aerial mosquito spraying, if you can click your raise hand button on the screen, and we will recognize you.
Garrett, I'm wondering if we can have that person identify themselves so that we can note who was in attendance.
Leslie, are you in? Yep, she has raised her hand. So to the chair, Leslie would like to speak.
Thank you.
Hi, I thought you were asking another Zipporah. Anyway, thank you for letting me speak. about the aerial spraying. I just want to say that it makes no sense. The mosquitoes are part of the cycle, and the pollinators need the mosquitoes to survive also. And I mean, spraying toxins over our beautiful forest makes no sense to me ever. I did send in a really good statement by email. Did you get a chance to read that?
We received it. It hasn't been read into the record or anything like that, but we did receive it. And
Okay.
I should tell the rest of the board that we received maybe half a dozen, 7 or 8 at most, emails objecting to the possibility of spraying, and 1 email that said the person was in favor of spraying when necessary.
Okay, well, is it possible to read my statement, or can you read what I wrote?
I don't have it in front of me, Leslie. If you want to read it, if you are just joining the meeting, I want to make sure that you are not under the misapprehension that there is a plan to spray the entire state of Massachusetts, whether or not there is disease. This is an emergency measure that the state has the right to do, and we have the right to preemptively opt out of.
Right, and I guess my reason for coming to the meeting is to hope that you're all, being that you're on the Board of Health, that you would understand all the potential health hazards of spraying. I know that Amherst is trying to opt out. I believe Wendell has opted out, and we're kind of sandwiched in the middle. So if they opt out and we don't opt out, we're endangering our neighbors as well. A lot of those sprays are bad for nerves. They're bad for lungs. They're bad for the wildlife. I could pull up my statement and read it quite, but at any rate, it just makes no sense at all. And if you are the Board of Health, I think health means that we work with nature, not against it. Spraying from the top doesn't do it. We get more bugs the more that we're doing deforestation. So if the industrial solar projects go through, we're going to see even more bugs. And so more spraying creates more imbalance, and more imbalance creates more disharmony in nature. And then we get more bugs, we get more diseases. So I really hope that when you get the chance, as soon as possible, that you read the statement of the people that emailed today and take it to heart. I know a lot of people weren't aware of this as an issue. And so all of a sudden it was like, oh my goodness, Shutesbury might be spraying. And then I went to the site on our Massachusetts state and opted out for my particular home. But if my neighbor didn't opt out, then I'm still in danger. And there's so much research about the toxins in these sprays that cause cancer and other diseases. And so if the Board of Health is really thinking about health, then please opt out. And I understand also that there may be more spraying, say, in the southeast of the state. Still, I don't want to see any spraying done in our communities right here in Western Massachusetts, especially in my hometown of Shutesbury. Thank you.
And Leslie, if you can just click your raise hand button for me, please.
Sure.
Thanks. So to the chair, Al Warner.
Yeah, this is a question for Kat, I think. Can you confirm that we are still on board with regard to the testing that will take place throughout the town?
Yes, absolutely. The Mosquito Control District, we have basically a contract with them, and they should be starting fairly soon to do the monitoring. And that would be, if we were to submit an alternative mosquito control plan, that would be an important part of it, that we have monitoring to determine if we have disease-bearing mosquitoes in our midst. And there would be other measures that we would take. The minimum requirement for an alternative plan is an education and outreach effort, which we already do. I mean, we every year put out messages about avoiding insect-borne diseases. And there's more, and we have the mosquito control district where we're having the monitoring, they could provide other in future, they could provide other services, but right now they would just give us advice if we had a problem. So I think that we have come to the end of the public comment part of the meeting, yes?
So to the chair, I show no further raised hands.
So obviously everyone is welcome to stay. Please be muted if you're not. And now the board will deliberate if there is deliberation to be done, and then we will vote. So it's up to us to speak now.
Well, I guess I'm encouraged that by voting to opt out, we are not removing any opportunities to deal with an outbreak. It just seems like we are pumping the brakes. We are putting another barrier or a fence that would sort of make it less likely that spraying would take place, and that we could revisit it if there was a major health concern. So, my inclination right now is to say we should opt out. And if we were to vote now, I think that's the way I would vote.
Are there other comments by board members?
If we are to opt out, am I right in understanding that we need to present to the select board a local control plan as an alternative in order to opt out?
That's how I read the regulations and the steps that towns must take.
Right.
And I believe we need to do that by the 15th.
So we need to come up with that alternate plan.
Well, I think
Right.
Kat has said, and she mentioned the fact that it's an education. It's primarily education. We already have some examples of what we've been doing to educate the public. We have the fact that we recommended and the town voted to become part of the mosquito district, where we are monitoring, in several key places what's happening. So I think we could just put that into words and present it to the select board and hopefully move quickly.
Good.
There may be a form. I haven't actually had time to get into the nitty-gritty of the application. The application comes from the select board, but it seems obvious that we're going to have to come up with a plan for them, assuming that they vote to apply to opt out. It's not automatic. We have to we apply to opt out by submitting an alternative plan to one of the alphabet soups of the state, and they have to approve it.
Okay.
So it's not a done deal, but I think we have a good chance.
Kat, just to help you a little bit, that alphabet soup is called the SRMCB, the State Reclamation and Mosquito Control Board.
Actually, I was thinking of the EOEA.
That's right. That's right.
They're the ones who approve the plan.
That's correct.
Whatever that is.
Yeah, I think I wrote that. That's the Office of Environmental Affairs.
Okay. Well,
are we ready
to vote?
Yeah.
Will someone make a motion that, well, let's put it in the affirmative. Will someone make a motion that we vote to recommend that the select board apply to opt out of the aerial spraying program.
So moved.
Second.
Second.
Okay, let's take a roll call vote. I'm going to go first because I'm first alphabetically. I vote yes. Noreen, I think you are next.
Yes.
Arlene,
Yes.
Garrett,
Yes.
Al,
Please.
what was that?
Yes.
Okay, all right, it's unanimous. We will make this recommendation. The select board will meet next Tuesday. Probably one or more of us should attend that meeting to discuss it with them.
All right. Well,
Thanks.
thank you. Yes, thank you to everyone who came tonight to speak about this issue.
And of course, you're welcome to stay. It's an open public meeting, but you probably have other things to do. All right, let's move on to the rest of our agenda. Hang on a second. Oops. I don't know why I'm seeing Leslie's picture here. Leslie, can you mute yourself if you're not muted? I don't know why I'm seeing your picture instead of other board members. No, she's.
Do you want me to leave? I thought it
No,
was
I don't
okay
want you
for
to
me
leave. I
listen.
just don't want to be looking at your picture.
Okay.
Nothing
Oh.
personal.
Kat, we can all hear you just
Yep.
fine.
It's just a
Okay,
matter
but
of.
now I see board members again. So that's good.
We just need to speak so that the
okay.
last person to speak becomes your picture you see
okay.
on your phone. That's
Right. I knew that actually.
And just to note again for the record, I believe there's a new person who's joined the meeting, Julian Lustig.
Julian joined us previously during the public comments on mosquitoes.
Okay, thank you.
Okay. So all these people are still here? I have a big list of participants and they're all still here.
I don't think there's
Okay.
anything else on TV tonight, Kat.
I guess not. We're the show. Okay. I have distributed to you all what I hope is a final draft of the open meeting law letter. And I am looking for approval for that letter.
Kat, this is Noreen, and I would move approval, but I just have one. It's actually a typo, I believe, which is in the last sentence. I think it should be, the very last sentence should be all 5 of us, add of.
Oh, yeah, you're right. Thank you.
I had one small word addition and then a question for the board.
Okay, go ahead.
So under item number 1,
Yes.
the sentence that reads, upon consultation with Al Warner and Catherine Hilton, I think the word on should appear before March 12th.
Oh, yeah, you're right. I had actually already squeezed that in. Thank you.
Great. And then my question for the board on item number 3, and Catherine, this speaks to an item that you mentioned at the beginning of the meeting about the first PFAS test result. And that is whether or not under item number 3, we want to explain how test results will be reported to the board and any information sharing we'd be doing with those reports.
That does not seem to me to be quite to the point of number 3, which is suggesting that there was a public meeting that we held that was to which access was denied. And I, in fact, don't know how we're going to share information that we receive. That seems to me, I'd like to hear from other board members. It seems to me to be kind of beyond the scope of this letter.
I guess I can agree with that. I'm just wondering how, I guess, they're going to report on these things.
How the program is going to report?
Yeah, and if we have any responsibility.
I don't think that we do. Maybe Al remembers this better. They send a report to the homeowner, and they copy us. And obviously, if they have a problem, we're implicated and expected to reach out and try to help solve the problem. But beyond that, I don't think we have, for example, I don't think we have a public reporting responsibility, but I don't know that.
I don't believe that we have any public reporting responsibility. As a matter of fact, as a person who opted into this program, my understanding is that you go into it hopefully with your eyes wide open, that when you get your test results are available, they will be reported not just to you, but to your local Board of Health, at which point they become a matter of public record, obtainable or accessible via the Freedom of Information Act, but not by way of the board making it public.
Okay.
Is that standing too well?
Well, yeah, I think there is this issue of, if there is a positive test, that it then potentially is a health issue that I think we can't turn away from. And so I think that, and especially if it's widespread. So I think I'm with Garrett. I think we need to talk this out. I think we need to figure out what the role of the Board of Health is with regard to this water testing, as well as other water testing that people might want to share with us.
Well, I would agree with that, Al, but I would not agree that it has a particular place in this answer to an open meeting law complaint.
Oh, yes, no, I agree.
Yep.
I agree with that.
Okay.
And I can appreciate that.
All right. Is there any more discussion on this, or would someone like to make a motion with regard to this letter?
I have one question. In our discussions of open meeting law, didn't we conclude, or didn't we learn that having two board members is not a quorum? Two board members attend a meeting is not a quorum, and therefore it was not a formal meeting that needed to be posted or documented?
Well, that's the really confusing part about this, because that is what the law says, but they're always changing it. And according to Becky and to Donna, the meeting that we took with DEP and UMass people was a postable meeting under some new regulation that I couldn't even find. So
is that point,
yeah.
Is that point though defined by who convenes the meeting? So the Board of Health, we didn't convene the meeting. We were asked to participate in a meeting with DEP.
It seems like they should have posted it, and they should have posted it on Shutesbury's town government site. So it seems like the rules were broken, but it's not entirely clear to me that we were the ones to break them.
Could I make a comment?
Oh, certainly.
There was some discussion at a recent planning board meeting about this issue. And Michael DeCara had reached out to the Attorney General's office for some guidance. And my understanding, and I, again, I'm no, I can't repeat exactly what he said, but the gist of it is that it hinges in part on whether or not you've designated a subcommittee or a working group. If you've designated two people to be part of a working group or a subcommittee, and there's definitions of that, then they have to consider themselves a body that has to post and hold a public meeting. But two individuals who are not tasked by a board, but go to some meeting and are now a subcommittee may not be subject to OML. That's just the thoughts I've heard.
That is very interesting because we were not designated as a subcommittee, and we basically selected ourselves to attend this meeting. We received a notification saying we'd like to have a meeting with somebody from the Board of Health, and two of us said we'll go.
Yeah, I think that it's not a straightforward issue. Obviously, it's good to err on the side of as much transparency as possible.
Right.
And there are some situations where it might be very difficult to function with that caveat. So that's all.
Thank you, Miriam.
Thank you.
That's helpful. I wonder then if we would want to go to number 4, where we talk about that. Well, we can go 2 ways. We can try to find our way through that, or we should have just said, sure, we should have posted it, and we didn't know we had to, and let it go at that. So what's the sense of the meeting? Do we want to just say, sure, we made a mistake? Or do we want to justify ourselves?
Does it set precedent about what we do in the future? Will people have expectations that we will, be doing this? It seems like we still have a lot to learn about it.
Yes, we do. We do. And one of the things that Donna told me in our consultation was that a lot of these, the way these complaints are handled has to do with education of the public bodies like boards of health. So they're not trying to, catch us and punish us. They are trying to educate us about how to do this better.
Well, I guess I'd be hesitant to say that we did something wrong when we're not sure that we did do something wrong.
Well, right now we've said this. We acknowledge that the Board of Health was remiss in not posting the meeting, blah, blah, blah. We were unaware that posting was required when, blah, blah, blah. So perhaps we want to say, we have been told that the Board of Health was remiss, which is true.
I guess if we were going to go that route, I'd want to cite a source that points to where we were remiss or how we were remiss.
Well, we kind of do, don't we? If we say we were unaware that posting was required when a quorum of the board was not present. Right, so we had not a quorum, but posting apparently was required anyway, and we didn't know it. So we made an error of ignorance.
I guess I don't feel strongly about pushing this. It's certainly, I think the wording that you came up with does the job. I think it may not be spot on as far as describing the situation, but I think it's good enough, and I think it accomplishes what we need to accomplish.
Here's another possibility. instead of saying we acknowledge that the Board of Health was remiss, we could say we acknowledge that the Board of Health may have been remiss.
I like that better.
How about the rest of you?
Yes,
Yes.
I do too.
Okay, you got it. 2 E's in Ben. Okay. Are we ready to accept this?
Yes.
Yes, I move that we accept the letter with the edits that have been made and that we vote on it.
Do I hear
Second.
a second? All in favor?
Aye.
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 Okay, there we go. All right, so this will be on its way tomorrow. Thank you.
Thanks for your work on that, Kat. I thought it was well written.
Thank you.
Agreed, Kat. You were really worked very hard on this, and we're all very grateful for everything you've done.
Well, thanks for saying that. I have to say, it seemed like I was writing all the time for a few days there.
Well,
What with
here.
one thing and another.
Thank you.
So a fairly big thing here. A town resident has objected to our promoting vaccination and not giving space to contrary arguments in which this person, or of which this person is convinced. And I sent you an email record of it. Arlene has proposed that we have a statement about our point of view that could go out with our weekly messages. Do you have that on you, Arlene?
Yes, I do.
Could you read it?
But I've also expanded my thinking about this since. So,
Okay.
let me start out by just reading the brief proposed statement that could be included in the weekly message. To keep everyone in Shutesbury safe and healthy, we are using the best science available to address COVID's threat to our health and economic well-being, including encouraging the COVID-19 vaccines. We know some people have questions about the vaccine. You can find the most accurate and up-to-date information here. And then we could add the link to what we consider to be the best all-around informational source online. Assuming anyone who's, oh, and unquote, by the way, and anyone who's receiving this message electronically by definition has got internet access, so they'd be able to follow such a link.
I think that sounds good. We don't have to come down in the middle of the road, right? On issues that we think are important regarding the health in town.
Right. So I think my expanded thinking on this, if I can go on for a little bit, but this is too long to include in a brief message. I think there's some confusion here about the difference between personal or primary health and public health advice.
Exactly.
So personal health decisions, such as whether one's vaccinated or not, or whether one takes conventional or alternative medicines or no medicines, or what sort of diet people eat or supplements they take, or, all these kinds of things. These are decisions that are best made on the basis of individual preferences and abilities, and in consultation with the healthcare provider who best knows their medical history. But it is not the responsibility of this Board of Health or any public health body to promote or inform about means of personal health maintenance. Rather, a public health body is charged, we know we're charged with, among other things, the control and prevention of communicable disease on the community level. And to this end, this board, we try to stay informed about research in the fields of infectious disease and public health as presented by the Mass DPH and the CDC. And then to our community, we in turn convey information about measures that have been shown by science to reduce disease transmission. And in the case of COVID-19, it's social distancing, it's mask wearing, it's hand washing, avoiding crowds, it's isolation and quarantine where they're indicated, and it's vaccination. And then all vaccines carry risk, side effects, but anything you put in your body it carries risk of side effects. And the decision to widely vaccinate against any one particular disease is made when the risk from the disease outweighs the risk from the vaccine. Currently available vaccines are safe and effective. And as we seek the end of this pandemic, I, for one, will continue to recommend that those who can be vaccinated do so. And this Board of Health can continue to provide links to sources where people can read about the risks and about emergency use authorizations and so on. But I do not think that it is this board's responsibility to cover all that ground in every communication we send out. So there's
I
my
would
rant.
agree, but I totally loved what you just said. And I would like us to work it up into a freestanding message that we would put out one time to the town.
Well, you might not have noticed that I was reading from something I had written, but I was. Because I can't maintain that kind of a train of thought that long.
Right.
So
No,
did-
I was aware that you were reading it. So
I
I
did have
realized
notes
we
in
have
front of
it.
me,
We
so-
have it almost entirely done. We
So
might
I can
wanna make
send
some
that to you
tweaks.
if you would like.
It
That
is
would be great.
definitely publishable.
Okay.
Yeah.
Yeah.
Thank you
That's
for that.
right. A book contract will be next.
Right, and an
Okey-doke.
excellent distinction, Arlene.
It
Yeah,
is
I think
public
it's a
health.
really,
It is public health versus personal health.
It
yeah,
is
I think
indeed.
that's a really important distinction.
Yeah.
And I think it was so good that why not put it on as a sort of almost like a mission statement on the Board of Health webpage,
Excellent idea.
so that people know what our charge and what we think our responsibility is.
Well, there are
I think
many
that's a good
charges that
idea.
we have having to do with water safety and public beaches and camps and everything else. It's not, but that's not our only mission, but it is the distinction between our role in this matter about promotion of a vaccination, I think,
Mhm.
an available vaccine.
Let's work it up, and I think it's virtually verbatim what you've done. Let's work it up and put it out as the rest of the message, the way we sometimes
Okay.
put extra information in our weekly report. And we'll put it out there, and then those are accessible from the website. And maybe we'll also have a separate heading for it. Think about a title that it will have that will make it clear. Then we'll give an idea, something of the content, and we'll put it up on the main part of the Board of Health website, or the Board of Health page, as compared to the coronavirus page.
Yeah, something like, not mission statement, but the charge of the Board of Health, or something like that, that sort of at least expresses what we see as our role with regard to the town health issues.
Right. I think that public health should be in that title.
I'll give a little more thought to that, and I will send, now what I should do would be to send it to the Board of Health email. Is that right, Kat? As a,
I think for something like this, you can send it to everyone if you want to, or you can just send it to the Board of Health email and I'll get it from there.
Okay.
We are not constrained from that kind of discussion. We're just constrained from discussion of business, as I understand it, but this isn't business, this is education, and that's part of our mission.
okay. I will do that.
And,
I may
and so,
not do it. I'm working a clinic tomorrow afternoon, so it may take a couple days before I get it to you, but I will.
Okay, well, if it doesn't go out this week, it'll go out next week, so it's not a big
Oh,
deal.
wait, no, that's Friday after. What's today's Wednesday? I have a whole
Right.
day that I was forgetting. Okay, I'm good.
Okay, well, we've just used it up on you.
Yeah. Okay.
Okay, that was really good. Thank you, Arlene.
Yeah, that was excellent. And I have another not relevant question, but are you working a public clinic and did you get notification already, Arlene? Because I
I'm at
haven't heard.
I'm at the John Zahn Center for Friday afternoon.
Okay,
As a vaccinator.
okay, thank you.
Did anybody volunteer for this walk-in thing where they want people to just walk around and encourage people to go in and get vaccinated?
No.
Yeah, that's kind of not me either.
I will say that I know of one walk-in clinic that generated 600 people
Whoa.
without appointments.
Was that in the
Wow.
eastern part of the state?
Yeah, so that was in Somerville and Medford. But they
And-
basically put out a tweet: existing COVID clinic, no appointment necessary,
That's
and they
great.
got 600 people.
Did they
Oh,
have that many
right.
doses?
Yeah.
Could they handle them all?
Yep.
Good. Excellent. Nice.
So
We're-
walk-in may be an option.
We're basically doing that with our next couple of clinics, through FERCog and MAFCO.
Oh, yeah?
Yeah.
So where are they going to have them?
There's
Do you
going
know?
to be one in Hollamont and there's going to be another one in Deerfield.
At the treehouse, or?
I think not. I think Treehouse Business is going live soon. So
Well, that's other good news.
I think it's actually going to be at their Public Works building.
Okay.
Yeah, it seems like if you're going to have a walk-in kind of thing, you don't want to have it out in the boonies where some of these have
Yeah,
been.
right. Yeah.
It seems like every time I go to work at a clinic, I just have to drive. Once I get there, I have to drive for miles just to get to the place.
Yeah, so just like the state and CDC are talking about, we're talking about locally having more targeted kinds of clinics or perhaps going into workplaces, churches, any large venues. So if anyone has suggestions about that, feel free to let me know,
Okay.
what your recommendations might be.
Okay. We've got a few more things on the agenda. We're not doing too bad. It's barely after 8 here. Library stuff. Marianne would like to put out sandbox toys and she doesn't want to wipe them up. She said that's too much trouble. And she wants to know if we think that's okay.
Yeah.
Anybody have any objections?
Defer to Arlene, but it seems to me it's all about airborne, or mostly about airborne
I
transmission.
agree. We are finding that surfaces are really not acting as vectors
Okay.
for this, but
Okay. Similarly, she wants to start the kayak loans again pretty soon, and she said she was planning to wipe down the paddles, but not the life vests.
Mhm.
And it just seemed a little weird to me that she'd do one and not the other. What's your sense on that, Arlene?
I think it's fine. I don't know that she needs to do either, but because people's hands are on the paddles, the handles of the paddles anyway, I think that.
Yeah, just in general, it seems
and
like a
it's
good
more
idea.
simply done. Yeah.
Yeah. So she was saying, I don't want to wipe down the life vests. I'll quarantine them for a day. Do you think that's necessary, or?
That probably would boost confidence among users. Yeah.
Okay. Okay. And I sent you all the email from Gillian Boudin about the storytelling program that is outside on the common, and it's going to be all separated out. I talked with Marianne today, and she said that they really seem to have it very safely organized with separate yoga mats for each group that will keep them in their one place. She also said she really didn't want to have any programs at all with people, but having seen how happy the children are to be going back to school, she didn't feel that she could really object. I assume we're satisfied with the rules that have been established for these things. What do you think about the masking rule? It's more restrictive than what's currently, than the current guidance, which is masking isn't necessary outdoors with social distancing.
Are you asking this in reference to the story walk?
It's not the story walk. It's a different thing where somebody comes in and it does storytelling and singing or something. It's a different program. It's people actually come in. I think it's limited to 6 families. And it's basically, you know, story hour, library story hour type thing, except that it's outdoors.
Well, I think that it is going above and beyond the mandate, or the fact that the mask mandate for outdoors activity has been removed. But it's certainly not harmful. And if she wants to include that requirement and still gets good participation, then more power to her.
Okay.
I have no objection to the programs that require greater precautions than,
Right.
you know, DPH orders.
Okay.
She may find if she doesn't get registration in the kind of numbers that she wants, that might be one thing she wants to explore. Is it a mask requirement that is discouraging to families?
I guess what I was wondering is, should we point out that we notice that she is imposing more stringent restrictions than are strictly required, and that, you know, that's entirely up to her.
Okay. In case she needs a heads up about that.
Yeah.
That makes sense.
Okay. I've got one other thing, I think. On 6 Haskins Way, this is kind of a petty matter, and I just thought I'd bring it to you. There's a building permit application in front of us to put on a deck, one of these things where there's already a screen porch and the deck is extending the profile of that out there. And it's pretty close to the well, but we don't really have, I mean, some wells are actually under the deck and some wells are even under the house. Our well regs require a 25-foot setback to a house. But that tends to be like not reciprocal. So you can't put the well within 25 feet of the house, but you can put the house within 25 feet of the well. And it looks to me like it's maybe from the wall, maybe 10 feet from the picture. And I wondered if we cared about that. It's down at the lake and it's very tight. I wondered if that was something you cared about, or you want me to just approve it.
So I'm sorry, the distance between the well and it's a wall, it's going to be the distance between the well and a wall, or distance between the well and piers?
No, yeah, it's going to be distance. Well, that's a good point, because the wall is already there and it's not going to change, and there isn't going to be another wall. So
it's just the concrete piers to support this deck extension.
Right. Right.
I mean, I haven't seen a plot plan or whatever you call it, but
yeah, I should have sent that around, but yeah, you're right. It's not really changing anything with respect to the well.
Kat, it looks like we have a question from Mary David.
Oh, well, let's let her ask it.
Hi. We actually went out from Conservation Committee and looked at that today, and
oh, what'd you learn?
And so the deck is going to be a small deck because of where the well already is. The well is already close to the house.
Yeah.
But it's not going to impact, building the deck isn't going to impact wetlands or water or anything else. So we didn't really have a problem with them being able to do it or see any reason why they shouldn't do it.
That's
So
good to know.
My only concern would be about any equipment they are bringing in for digging for and pouring any concrete footings or piers or whatever you call those things.
Mhm.
But we would want to be concerned about any heavy equipment crossing any lines that could be damaged, or probably wouldn't happen, but they should just be careful about that.
Yeah,
There's a water
sometimes
supply
we put
lines
a note
underneath.
on that, yeah.
Yeah.
Yeah, there's very limited access to being able to get to behind the house just because
They might want to hand dig the holes they need.
They'll
Yeah.
probably have to.
yeah, I don't think they're going to get any heavy equipment back there.
Okay.
I'll check with the guy. I have an email with the contractor about how they're doing it, and I'll suggest that it should be hand dug if that's not the plan.
Do we know anything about the well? Is it a cased well down to bedrock and that sort of thing?
I'm not sure that we do know anything. Give me a second and I will see if I can find out.
Because I worry a little bit more if it's actually just an unconfined well that is more easily contaminated from surface penetration.
Find. We don't have the well data. We do have a couple of Title V inspections, and they would only give us the well location. We usually don't get any well data about it, so apparently not. What that suggests is that in the past 30 years, they have not put in a deep well, because that would be in our records. So I'm guessing it is just the shallow well or something. Mary, what did you notice about the well? Did it have the big like barrel caisson on top? Or was it a pipe?
It looked more like a pipe.
Oh, so maybe it is a deep well.
Al, you're muted.
Like a 6-inch pipe?
Probably about that big.
Okay, that would suggest that it was probably cased down to bedrock. I guess that's not a for sure thing, but suggestive.
Mm-hmm. That make you feel better?
Little.
Do you feel that that it would be dangerous to do this work?
I mean, it's really hard to say. It depends what sort of deck material they're using. I guess one concern I might have would be anything that is being weathered and leached off the deck. The preservatives that they use in outdoor decking boards. If it can go directly down vertically right into their well, then yeah, I think that's somewhat of a concern. That's why it matters a lot if it's a deep well or not.
I am sending you the plot plan by email, Al.
You're muted again, Al.
What's with this guy?
I don't know. He's talking. Al, you're
Al.
muted.
Al. Al.
He's mocking us. He's mocking us.
Okay, I'm going to stay unmuted.
All right, he's pranking us. Yeah.
So, do you want me to look at something now, Kat?
Well, you seem to be interested in it, so I emailed you. I forwarded you the plot plan.
Okay, but that's not going to tell me what the depth of the well is. It'll just tell me the position of the well.
We're never going to know that.
Yeah.
Well, how do you think we should proceed?
You know, I think that it is probably not a big change. It's not a big deviation, and I think their options are fairly limited. So I think I'm okay approving it.
Okay. Everybody else feel the same way?
Yeah.
Yep.
I'm good.
Okay. Okay, will do. Have I left anything out that we were supposed to do?
No, none that I know.
Cool. Well, I think that all went really well.
Yes.
Yeah. A very well-run meeting. Thank you.
Exactly. Yes.
Well, it took basically all of us to do it. All right, thanks for what you were doing, Garrett. I appreciate
No
that.
worries. I mean, in many respects, meetings during COVID are far more public than they have ever been.
Mm-hmm.
So
Yeah. I'm glad that we invited people and that they came and
Yeah, I am too.
Think
And
that
they seem
gave
to
us.
be they seem to be appreciative of that as well. So that was good.
Yeah. Okay. I think we're done. That was amazing. I thought we were going to be here till like midnight.
So with your approval, I will stop recording.
Okay.
Oh, I guess we have to officially adjourn. I would move
Okay,
to
well,
adjourn.
second. Anybody not in favor, just you can stay on, with the rest of us are adjourning. That's
right.
We'll call it.
Okay.
We'll call it 8:20. Yes.
I want to make sure that Cliff is happy with everything.
Yeah, right. I had no idea he was coming to this meeting. So I was as surprised as anybody to see him there.
Yeah, last I looked, he was still here.
Yeah.
Yes.
There he is.
There he is.
There he is.
I'm thrilled with everything, except I wish that Al would take off his mute button. Aside from that, thank you for all your great work. And
he's become a groupie.
Yes.
Right. A fan. Right.
yes, well done all.
All right.
Thank you.
Right,
Okay,
and
well,
I'll stop
thanks,
recording.
guys. That was really good.
Yeah.
Thanks for
was.
all your stuff. Noreen, we'll get to